Did you know that there is a treatment option for erectile dysfunction that can turn back time a couple of years and restore function without having to take further medication or use additional devices every time you want to have sex? On Eurochannel, I am going to explain low-intensity shockwave therapy. What is it? How does it work? What results can be expected? In case this is your first visit to Eurochannel, welcome! My name is Stefan Buntrock. I'm a urologist with a subspecialty in sexual medicine. My content is intended to help you understand urological issues, treatment options, and medical thinking. And I do my best to appear not too boring. However, sometimes information has to come first. I am asked all the time about how low-intensity shockwave therapy, ESWT, works. For this reason, this video is to explain ESWT to you so that you are able to understand the hype that's going on concerning this treatment modality. If you're looking for medical entertainment, however, check out my playlists and watch me explain intriguing sexual syndromes, speak Hindi, or comment on TV shows. So let me explain shockwaves to you. Shockwaves were discovered already in the early 20th century by airplane company Dornier in Germany. But it took quite a while until they were introduced into medicine, more precisely into urology, because shockwaves have the power to destroy kidney stones from the outside of the body without having to perform a surgical procedure. February 20th, 1980, the first so-called lithotripter went into action. The rest is history. A shockwave is an acoustic wave, a very short and rapidly increasing pressure pulse of around 0.3 microseconds duration. When looking at it graphically, it spikes rapidly, pushing the tissue very hard, and is then followed by a pressure drop even below its starting point, becoming negative, thus pulling on the cells. There are different possibilities how shockwaves are produced. For use in urology, three different sources of energy are used: electromagnetic, piezoelectric, and electrohydraulic. Low-intensity shockwave therapy, ESWT, is done at much lower energy levels as high-intensity ESWL for kidney stone treatment. This is why there is no need for anesthesia in low-intensity setting. It is currently unknown whether the source of energy matters in terms of biological efficacy. There shouldn't be too much of a difference, but this point hasn't been researched yet. What matters are treatment protocols to establish the energy level, the mode of delivery, the number of shockwaves per session, how frequently treatment sessions take place, and how many sessions are needed for the treatment as a whole. This is the reason why clinical studies are difficult to compare. In the literature, there is large variability between treatment protocols, like Study A uses 1,500 shockwaves per treatment 2 times a week, and Study B uses 5,000 shockwaves with double the energy per session, but only once a week. It becomes evident that these two studies are not necessarily comparable when it comes to result. Furthermore, some applicators for shockwave delivery lose power during their life of service, while others are able to give 100% right until the end. So doing research with an applicator that loses power, has been used a lot and will break soon, might alter the observed clinical results. Another confounder would be the patients themselves. The reason for the individual erectile dysfunction has to be established beforehand, so that a homogeneous group is treated and not a mixture of ED resulting from atherosclerosis, veno-occlusive dysfunction, and psychogenic ED. I think you understand by now why ESWT is still a matter of debate. So, what is the mode of action? Or better, what do we think the mode of action is, since much is derived from animal studies which cannot be transferred to humans without reservations. Most probably 4 key effects will take place. First, Shock waves will form new blood vessels and heal compromised blood vessels. Already very low energy levels drive angiogenesis, which is the formation of new blood vessels. Additionally, vascular aging changes flow parameters of the bloodstream and thus disrupting endothelial signaling. The endothelium, by the way, is the inner layer of the blood vessels. Shock waves restore endothelial signaling, which is particularly important when it comes to the release of nitric oxide, which is vital for inducing erections. Second, ESWT most probably activates stem cells. Stem cells are the raw material that is molded into all kinds of tissues, such as muscle cells, nerve cells, or blood cells. Stem cell activation is important because it furthers regeneration. It has been shown that apparently a kind of tissue remodeling takes place. During this process, the ratio of smooth muscle is increased, and smooth muscle, that's the stuff in the corpora of the penis. Third, shock waves stimulate nerve repair. It is as simple as that. Without nerves, no erection. So the better the nerves do their job, the better the chances are for an erection. Fourth, finally, sympathetic tone is reduced. The sympathetic nerve system is responsible for certain reactions of the body if threatened. In short, when the sympathetic system is on, we are ready to fight or run away. With either option, having an erection at the same time would not be very much advantageous. You simply don't run well with a boner. So this means that reduction of sympathetic tone by ESWT facilitates erections. If you have any questions, post them down below. Please consider subscribing for more content like this, and I see you in another video on Eurochannel.